Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. This is episode 199, folks. Thank you for being here with me today. If you're unfamiliar with my work, my name is Christian Brindle. I own a company called Christian Brindle Insurance Services, where we work with people in 10 states on the Medicare health plans. I've published 3 books on insurance, 2 specifically about the topic of Medicare. And folks, we've been doing this podcast for roughly about 2 years now, bringing you Medicare information in a podcast form and format that you do not get anywhere else. And folks, on Monday's episode 198, I did make an announcement that I was going to be doing an interview on the show with Galen Hendricks of Senior Security Benefits. I got that mixed up. We're doing an interview with Galen Hendricks, but not for the podcast. So I do apologize about that. We're doing it for a different type of forum that we work with. We do a lot of different media here in our offices. So I do apologize about the misconstrued information, and I apologize for me being a little mixed up on that. Sometimes we have so much going on here in our office. My mind gets a little funky, you know. But folks, today on episode 199, we will be discussing FEMA. Now, for those of you who are unfamiliar with what I'm talking about with FEMA, FEMA specifically stands for, the Federal Emergency Management Agency. FEMA is an agency that, is a United States government agency. It's of the United States Department of Homeland Security. It was created by President Jimmy Carter in 1978 and implemented by 2 executive orders on April 1st, 1979. Now, FEMA specifically, their job is to, for the most part, handle national disasters, natural disasters, disasters in general in our country. FEMA assists with hurricanes in hurricane locations. FEMA assists with earthquakes. FEMA assists with a tremendous amount of things across the country. Now, there was a FEMA announcement. Well, I should say a CMS announcement, an announcement from the Centers for Medicare and Medicaid Services, that they were coming out with a special election period. And this was several months ago, right when the whole coronavirus pandemic really started to ramp up nationwide. And the insurance companies had all reported it. They had all made it public. And then a few days after that, they had they had basically come out and said, we had miscommunication with CMS. This is not going to happen. So if you recall, we did an episode about that specifically. And we had to do a retraction of that episode. The first retraction I've ever had to do on this show. Made me feel silly. It was embarrassing, and I was very, very upset about it because we've never had to do a retraction before. So this time around, when the Centers for Medicare and Medicaid Services and a lot of the larger insurance companies started to announce that they had indeed been given the green light on a special enrollment period for people on Medicare, I sat on my hands a little bit as far as doing an episode to see if this would actually stick, to see if this was actually a reality, and they weren't just going to yank out the carpet from us. And it has stuck. So we decided to do an episode about it here today. Folks, I do have to take a break. I'll tell you everything you need to know about this FEMA special election code and period when we come back in segment 2. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks so much for sticking with me through that break. Let's talk about this FEMA special election period. So, folks, some time ago, this year I actually believe is when we actually shot this podcast, and when we recorded it and released it, I did a special election period code topic on one of our episodes, and we dedicated an entire episode to it. I'll see if I can find exactly which episode it is. I mean, when you have 200 plus episodes, or borderline 200 episodes, it gets a little tricky navigating through that library of content that we have. But I'm very proud of what we've been able to kind of bring to the table. I really think that we're doing what nobody else has done. And I think it's very, very important, and I think it's very, very industry-changing, if you will, what we're kind of bringing to the table in a lot of ways. And if I can't find this relatively soon, I'm not going to continue looking for it. But we have done so many episodes. Oh, there we go. Okay, so it's episode 142. It was released January 13th. It's called How Can You Sign Up Outside of the Enrollment Period? And it talks about special election periods. Basically, in a nutshell, special election periods are SEPs, as they're called in the industry. Special election periods are basically reasons that a person that's on a Medicare Advantage plan or a Part D prescription drug plan can change their plan outside of the Medicare open enrollment period, which of course is October 15th through December 7th. And typically, in most cases, it has to be under the event of a life-changing event. You moved out of your state. You went in or out of a nursing home. You have Medicare and Medicaid. You have what's known as extra help or low-income subsidy. There's a lot of different reasons. There's even a special election period code for if someone was recently released from incarceration in jail or prison. There's a lot of them. And some are more relevant than others. Some you see more often than others. There's one for if someone is losing their employer group coverage. Basically, they're precautions that are put into place so that people can enroll into a plan and they're not stuck with nothing if they have a life-changing event outside of the enrollment period. Right now, this time of the year would be a prime example. What they have done is they have released a FEMA special election period code. And this is not to say that they have not done anything like this in the past. They have done something like this in the past for areas that were hit by hurricanes. I remember when I was living in Florida and Hurricane Irma had come through, there were certain parts of the state that were granted a FEMA special election period for people that were affected and they might be able to change their plan. So this is how this typically is going to work. Earlier this year, we had a time period called OEP, stands for Open Enrollment Period, which basically is like you could almost think of it like a mini annual election period, but it's quite a bit different. We're not supposed to advertise it, not supposed to talk about it. I mean, there's just a lot of things. But that goes from that went from January 1st to March 31st. The rules in play for the FEMA special election period are this. If you had access to another special election period code, or let's say OEP in January. Now, of course, this is going to mainly impact those of you that are on Medicare Advantage plans. Medicare supplement plans, as I'm sure you all know, are month to month. If you want to change your Medicare supplement plan to another Medicare supplement company, you can do so any time of the year, as long as you can pass the necessary health questions and underwriting criteria, and we've done never-ending episodes about that on this show. So if you want more information about that, go find one of the many, many episodes we've done about Medicare supplements, health questions, and underwriting. But that being said, if you had access to one of these special election periods, which, every single person on a Medicare Advantage plan had access to OEP in January through March, if you had access to one of those codes and you did not use it, you're able to change your plan one time due to the FEMA special election period. If you did use your OEP election period in January through March, you're not able to use the FEMA special election period. That's pretty much the way it works. If you did not use basically an easy way to think of it is if you did not change your plan this year, you can change it. If you have changed your plan this year, you probably can't. And this is effective for impacted areas by the COVID-19 pandemic, which is pretty much every area was impacted in some way, shape, or form by the COVID-19 pandemic. So if you're on a situation that you don't like your plan, there's something that is available that FEMA has come out with, the Centers for Medicare and Medicaid have come out with, and it's an option that you have available to you now. Folks, I have to take one more break. Stick with me. I'll be back in segment 3. Have some final thoughts I'd like to share with you. Don't go anywhere. Welcome back, everybody. Thanks so much for sticking with me all the way to the end. Folks, we want to do something really big and really special for our 200th episode. I can't tell you exactly what it is, but just keep in mind that the 200th episode, which will air on Saturday, today being Wednesday, will be a big one. I'm so excited about it. You're not going to want to miss it. And this is our way of saying thank you for supporting us from the beginning. As always, folks, if you're about to be on Medicare or you're maybe on Medicare and you're just not sure if what you have is the best thing for you, whatever your case might be, our office would love to help you. We do business in 10 states. That would be Utah, Idaho, Colorado, Oregon, Washington, California, Texas, Virginia, South Carolina, and Florida. Again, that's Utah, Idaho, Colorado, Washington, Oregon, California, Texas, Virginia, South Carolina, and Florida. Our office number is 801-255-5340, 801-255-5340. I would love the opportunity to talk with you. Until next time, folks, thanks for so much overwhelming support over the years. You're not going to want to miss Saturday's episode. I'll talk to you then. Take care.